Hi everyone, it's Wednesday, time for a little Wisdom Wednesday. Today I want to talk to you a little bit about low-dose naltrexone. Now normally naltrexone, which is an opioid antagonist, has been used for alcohol and opioid addiction generally in facilities, and it's dosed somewhere between 50 and 300 milligrams. But over time, studies have revealed that using lower doses can actually benefit and modulate the immune system. And so therefore it's been used in a lot of autoimmune disorders as well as other chronic illnesses associated with inflammation. It was discovered and FDA approved back in 1984, but since that time, many people who have been researching it have been utilizing it in very low doses with this aspect of modulating the immune system in chronic illnesses, particularly autoimmune disorder and pain issues. What happens and how it works in these low doses is that it hits the opioid receptor in the brain. It stays there for 2, 3, 4 hours, and the body senses that there are lower endorphins. And so because of that, there is this rebound production of endorphins in the body, which increases the ability of the body then to begin to modulate the immune system. And the way that it does that, because these elevated endorphins stay around for about 18 to 20 hours, it can upregulate a lot of the aspects of the body's immune system. And in doing so, it has been shown that it can downregulate cytokines. So perhaps it has some possible benefit in downregulating the possibility of a cytokine storm. It reduces inflammation and oxidative stress. It can facilitate tissue healing and wound healing, so that's wonderful. It does an awful lot with the T cell and B cell aspects of the immune system to bring things into balance so that there does not seem to be an imbalance in both T helper 1 and T helper 2 cells, which can create a cytokine storm. It can regulate cell growth and perhaps even regulate and diminish tumor growth. It has been shown to help with mucosal healing, particularly in the lining of the gut, as well as myelin-producing cells, which are around nerves. So it has a lot of just general abilities in terms of balancing and modulating the immune system. Now, what that means is that there are a lot of conditions that are affected by this, and there have been definitely published studies with low-dose naltrexone, and that dosing between 1.5 and 4.5 milligrams. The clinical studies that have been done on Crohn's, fibromyalgia, melanoma, cervical cancer, ulcerative colitis, glioblastomas, other gastrointestinal disorders. It has been shown to be beneficial in multiple sclerosis, prostate cancer, even in autism, metastatic cancers of all kinds of in terms of breast cancer, irritable bowel disease. We've used it in patients with psoriasis, rheumatoid arthritis, lupus. So there's a vast array of areas where it might be beneficial. And I was reviewing information about this and also looking into it as well, because it's an immune modulator, could it possibly have some benefit as far as what we're dealing with SARS-CoV-2. And indeed, there are studies now being done because theoretically, based on its method of action or mode of action, the low-dose naltrexone has the ability to actually prevent cytokine storm and has been shown to disrupt the interaction of viruses with ACE2 receptors. So it possibly could be considered as a target as a treatment or adjuvant therapy for the coronavirus. So there is an ongoing study now with colchicine and LDN that are being done, a small study, but being done on hospitalized patients. But there are some other studies being looked at as well. And of course, we're looking at all different types of repurposed medications, and Merck is supposed to have an antiviral that's out soon as well. So we are continuing to kind of look at all options for ways to manage this as we continue to fight this virus, and just wanted to share one other possibility of an immune modulator that perhaps could have some benefit as well. This particular medication has to be compounded. There is not a pharmaceutical amount available. There is one product that has naltrexone in it that is a weight loss product. So it's possible that it has some potential as a benefit to weight loss in addition to other ways of losing weight, particularly lowering your intake and modulating timing of intake. So it does help. It's in a medication called Contrave, and I think there's 10 milligrams of naltrexone in that. So just to let you know a little bit about that, if you are interested and want to learn more, I would just look things up. And the way that you're going to find it in searching for it is most people see it and label it as LDN, low dose naltrexone, Naltrexone, but you will find it mostly listed as LDN. Hopefully that's given you some food for thought. You all have a great week, and we'll touch base again next week.